There has been much controversy regarding the COVID-19 pandemic, but one thing that we can all agree on is that we want it to be over. But how and when will the COVID-19 pandemic end? There have been many surprising similarities between the COVID-19 pandemic and the Spanish flu pandemic of 1918. Meet Dr. Paysinger, a historian and educator at the Athens Renaissance School.
I'm Chris Paysinger. I'm an American history teacher, specialized in cultural history. So what I like to look at is like the impact of events on people. To me, the Spanish flu and the current pandemic is super interesting because what it's ultimately showing is what people care about and how they react to positive and obviously negative things that happen.
When hearing about the Spanish flu, I always hear about deaths and how infectious it was, but I don't really hear anything about the solutions. So what solutions were attempted during the Spanish flu pandemic?
What you're really looking at the time of the Spanish flu in 1918, it was still ultimately the medical Middle Ages. Some of their methods were very, very crude. For example, they felt that that maybe the dust carried it, and so that they would wet city streets in an effort to keep the virus from spreading.
Now, how do those solutions compare to the solutions that we're doing now with the COVID-19 pandemic?
Even though in 1918 they were very much struggling to understand what was going on, maybe the reality is in 2020 we weren't so far removed in trying to understand this new virus. I think we all bought into the fact that maybe we did know a lot about it, when in reality, scientists at the time were very much searching as much as the scientists were in 1918, 102 years prior.
Let's now discuss some of the possible solutions to the COVID-19 pandemic.
Isolation, one of the very first solutions attempted during the COVID-19 pandemic. During the COVID-19 pandemic, isolation may be practiced if a person is sick with the virus or if they have come in contact with someone with the virus. Masking is another possible solution that, as of January 2022, is still being encouraged in many parts of the world. Though masks do not fully protect one from the virus, they may assist in reducing the spread of COVID-19. Vaccination has had a very important role in the end of COVID-19. The COVID-19 vaccine is given in order to give people the immunity they need. As of January 27, 2022, 52% of the whole world's population has been fully vaccinated. Therapeutics are treatments or medications that may be used on those suffering from the virus. As therapeutics for COVID-19 are studied and improved, they will also play a great role in stopping the pandemic, making a serious COVID-19 case much less common. This leads us on to our last solution, which is herd immunity. Studies show that those previously infected with COVID-19 or vaccinated are unlikely to be infected with certain variants of COVID-19 afterward.
Bill Nye the Science Guy.
A study by the CDC performed in October of 2021 during the Delta variant shows that those who have been infected with COVID-19 then vaccinated and those who have been infected and not vaccinated have the same chances of getting infected again. The study includes data from 4 different groups: unvaccinated with no previous diagnosis, vaccinated with no previous diagnosis, unvaccinated with previous diagnosis, and vaccinated with previous diagnosis. Those with neither vaccination nor natural immunity are at the highest risk. Bummer. Those with vaccination and no natural immunity are at a very low risk. Unvaccinated with natural immunity and vaccinated with natural immunity are both at an even lower risk, with natural immunity being around 6 times more effective than vaccination alone.
The Spanish flu really disappeared almost as quickly as it appeared. And we know today, of course, that was because herd immunity happened. And when that herd immunity happened, when enough people had been infected, overnight it almost ceased as quickly as it began.
What do you know about case spikes during the Spanish flu?
Case spikes during the Spanish flu were really just like what we've experienced with the Delta variants, the Omicron variant, and in some there were very few deaths, and in others there were significant numbers of deaths.
As of February 2022, the Omicron variant is giving natural immunity against both itself and former COVID variants. This is why the Delta variant has nearly disappeared, and the Omicron variant is now the cause of almost 100% of all COVID cases. The natural immunity that comes from Omicron may mean the end of this pandemic.
Coupled with the COVID-19 vaccine, therapeutics, and other restrictions mentioned, the natural immunity that Omicron gives may be the solution that we've all been waiting for.